Hey everyone, my name is Brenna and today we're going to be talking about birth control. Birth control methods range from condom usage to abstinence to the hormone pill. These are probably the ones that you're most familiar with. Today, however, I'm working with the Happy Body campaign to talk about some other methods that are available to you as a female. Even if you are not currently sexually active or have never been sexually active, understanding the methods that are offered allows you to make a more informed decision when and if birth control is something you would like to consider. I will be covering 8 different methods that are available to girls and women, either as a prescription or over the counter. So, for example, abstinence or the pulling out method will not be included because those are behavioral actions that require consent from both you and your partner about a form of birth control that you as the female do not have 100% control over. That is not to say that these methods will not work for you and your partner. However, the Happy Body campaign aims to empower girls and women to be in control of their reproductive health and make informed decisions about their own bodies. So, let's begin. The 8 methods of birth control I will discuss today fall into 3 categories: hormonal, barrier, and clinical, or HBC for short, hence our campaign name. I'll begin with the hormonal options, which include 1, the pill, 2, the patch, 3, the ring, 4, the depot shot, and 5, the emergency contraceptive pill. All of these require a prescription except for the emergency pill, which are over the counter. The pill is pretty common, and I'm sure you've heard of it before. They come in a packet with instructions on how to take the hormone pills versus the placebo pills in the last week of a 4-month cycle. They are to be taken once daily at the same time each day. Other than preventing pregnancy, they can potentially help you in regulating your periods, decreasing cramps, and acne control. The pill is our first hormonal birth control method. The second form of hormonal birth control method is the patch. The patch functions similarly in that it releases hormones so that your body does not release an egg. It looks like a square band-aid and can be worn even when showering, swimming, exercising, or sleeping. You change it once a week, 3 weeks in a row, and then on the 4th week, you do not wear the patch and have your period, similar to taking the placebo pills in your last week if you're using the hormone pills. It can also provide benefits in controlling your cycle, cramps, and acne. If you don't want to worry about taking a pill every day, this is a 3 times a month commitment, and as long as you always check that it's on your body, you're good to go. The NuvaRing provides the same benefits as the pill and the patch because, again, it is a hormonal method, but instead it is an internal ring that sits inside your vagina. It is small and flexible, so it is totally not painful, and it's easy to insert and remove. It only needs to be worn 3 weeks out of your 4-month cycle, so it only needs to be removed and inserted once a month, similar to the hormonal pill and patch. But it is a smaller time commitment than both the pill and the patch. So that is our 3rd option. The 4th option is if you're looking for a hormonal birth control method that you only need to think about 4 times a year or once every 3 months. It is called the depot shot. And it might be your preferred method. It requires that you go into a clinic because it is a shot administered by a doctor or nurse. However, it is slightly more effective at preventing pregnancy than the pill, patch, or ring. It also thickens the mucus of your cervix, an internal part of your vagina, so that it's harder for sperm to enter your uterus. If needles don't faze you and you are really concerned about pregnancy, this would be a great option because of its effectiveness and low commitment. Lastly, 5th and last is in our hormonal category is the emergency contraceptive pill. You might have heard of it be referred to as the morning after pill. And unlike the 4 methods that I've already discussed, this method is effective after unprotected sex. It works for up to 5 days after you do have unprotected sex. It also differs from the methods I've already discussed because it does not require a prescription and is available at drugstores or health centers. They prevent your body from not only releasing an egg, but also in the fertilization of the egg from the sperm and the implementation of the egg into your uterus. If you and your partner do not use a condom or the condom broke, your partner did not pull out effectively, you are a victim of coerced vaginal sex, or another preventative birth control method was not effective, such as forgetting to take your pill that day, then this is the option for you. This is not a primary birth control method, hence why it is called an emergency contraceptive option. If you're regularly having sex or potentially be having regular sex, consider other options before resorting to this method. So, in conclusion, the 5 hormonal birth control methods include the pill, the patch, the ring, the shot, and the emergency pill. They all have hormonal side effects, some positive, some negative, and do not prevent against STIs when used alone. They all require a prescription and careful attention of how they need to be taken or changed, except for the emergency pill. Next, I will discuss barrier birth control methods, which is the second out of the 3 types. In this category, there are 2 methods, the female condom and the cervical cap. The most common form of any barrier birth control method is a male condom, which you can find at any grocery store. However, these 2 barrier methods allow you as a sexually active female to be in total control of preventing STIs and pregnancy. The female condom looks similar to a male condom but is inserted by you into your vagina, not on your partner's penis. They can be bought in drugstores for less than $5, and like male condoms, they can slip out or be incorrectly placed, so be sure that it is both preventing pregnancy and STIs. You need to make sure it does not slip out or is punctured in any way. It functions similar to a male condom in that it traps the sperm and is then removed and thrown away after each time your partner comes. The female condom can be used in both vaginal and anal intercourse, but cannot be used alongside a male condom. The cervical cap is a bit tricky and does not prevent against STIs, unlike the female barrier condom method. But it can be useful because you insert it into your vagina hours before intercourse, so you don't have to think about it in the moment. Similarly, it must stay in your vagina for 6 hours after intercourse. This barrier form essentially is a cap over your cervix, which is the entrance to the uterus, and does not allow for sperm to enter. After 6 hours, it is removed, can be washed, and is then reusable. You do need a prescription for this method, and a doctor will fit you in your correct size and tell you exactly how to insert and remove the cap. Use a condom, either male or female, for prevention of STIs alongside the cap. The last method of birth control falls under the C, or clinical category. It is called an intrauterine device, or IUD for short, as you might know it. It is inserted by a clinician into your uterus, hence why it falls under this category. It is a T-shaped, flexible plastic device that sits in your uterus. It is the longest lasting method of all the ones I have mentioned previously, with a duration of 12 years of a prevention against pregnancy. It can be removed at any time if you decide you do want to become pregnant, but does not require any daily, monthly, or yearly attention. This is a great option if you are certain pregnancy is not in your future and you do not want to spend any time worrying about it. However, it does not prevent against STIs, so a female-male condom is advised with this method as well. Okay, that was a lot, I know, but it is so important for you to know what is available to you. Knowing these forms of birth control can help you be more empowered about your health and give you the ability to choose or change up your reproductive health routine based on what you want and what you prefer. The 5 hormonal options are mostly prescriptions, but they can help against you with controlling acne and your menstrual cycle. The 2 barrier options require you to have something inside your vagina during sex, and the female condom prevents both pregnancy and protects you against STIs. Lastly, the clinical option is long-lasting, stays inside your uterus, so you really don't have to spend much time or effort to prevent pregnancy. Talk to your healthcare provider and your parents, peers, friends, or anyone you trust about what options might work best for you. A happy body is an informed and empowered body, so check out Happy Body Campaign for more information. Thanks for watching. Bye!